So the tourmaline maintenance trial looked at the oral proteasome inhibitor ixazomib after stem cell transplantation, for patients with multiple myeloma. As I mentioned before, ixazomib is an oral proteasome inhibitor, and I think one of the nice things about this particular agent is not only its convenience, but it has a very good side effect profile. And obviously proteasome inhibitors are very important in the treatment of multiple myeloma, so it only makes sense to evaluate ixazomib in a maintenance setting. So patients were randomized. This is a placebo-controlled trial, and after stem cell transplantation, patients either received ixazomib or placebo. And at the end of the day, there was an improvement in median progression-free survival with ixazomib in the maintenance setting compared to placebo. And specifically, it led to about a 27%, 28% reduction in the risk of progression or death compared to placebo. Now, the elephant in the room is lenalidomide or Revlimid, and we have a very robust maintenance data with lenalidomide. And I think what's pretty clear, and I'm comparing across studies, so we have to be a bit cautious here, but the magnitude of benefit with regards to progression-free survival is considerably longer with lenalidomide than with ixazomib. So I don't think it's going to replace lenalidomide as a maintenance therapy after stem cell transplant. That said, I think we can say one of two things. First, for those patients that don't tolerate lenalidomide well, I think this is a terrific alternative option for those patients. And then the second thing that I would say is we still don't know the best maintenance strategy for patients with high-risk disease, whether you give them lenalidomide monotherapy or ixazomib monotherapy. They relapse much faster than we would like. So I think ixazomib, given its very good safety profile, would lend itself very well in maintenance combinations, including, for example, lenalidomide.